Hey, how would you like to make some money for not much work? How much? Like $8,000? Oh, sorry, sir. I wasn't talking to you. I was talking to the ladies. All you have to do is give yourself a few injections, come to the clinic for checkups, and have the final procedure to donate your eggs. I gotta admit, it sounds like a pretty good deal. And that's what the posters hanging in colleges across America want you to think. If they included all the details, it could sound more like this. Hey, how would you like to make $8,000 for donating your eggs to a family in need? There could be some side effects, the main one being ovarian hyperstimulation syndrome, but you probably won't have that. And you probably won't have the complications that could come with it, such as kidney or liver dysfunction, or death from thromboembolic events. Probably. You can see why they don't put this on their posters. So, what is ovarian hyperstimulation syndrome, or OHSS? And why do egg donors get it, and why haven't I heard of it? Well, before egg donation, it wasn't really a problem, because it's caused by the drugs given to egg donors. Normally, one egg is released from the ovary in a cycle. But doctors think that they have a better chance of having a successful pregnancy if they take more eggs at once. They usually shoot for around 20. Let's put this in perspective. The mammal with the largest litter size is a tenrec native to Madagascar, with litters of 15. This is still less than what physicians want egg donors to produce in one cycle. If it sounds abnormal, that's because it is. And it's this abnormality that causes OHSS. Normally, one egg leaves the ovary, and if it's not fertilized, the sac that the egg came from disintegrates inside the ovary. If the egg is fertilized, then the sac stays in the ovary, releasing hormones, and is called the corpus luteum. So, we have step 1, stimulate the donor to make more eggs. Step 2, retrieve the eggs. And then the outcome in patients who get OHSS is that the corpus luteums stay inside the ovary, aggravating it, which leads to the first symptom, which is abdominal pain. This doesn't have to happen though. There are 3 different procedures that can be used. We'll go in chronological order, starting with the first one created. The donor is given follicle-stimulating hormone. Then they are given the trigger shot, and each procedure has a different trigger. The trigger shot is given so the eggs that have matured will be released from the ovaries. In the first case, this trigger is human chorionic gonadotropin, or HCG. It can be a little confusing to understand, so here's an analogy. Pretend you're an introvert, and your friend decides to throw a party, and they live with you, and they invite everyone they know. It gets to be 11 o'clock, and you want to go to bed and have everyone leave, but your friend doesn't. They want to keep it going all night long, which makes you unhappy and aggravated. In this scenario, your friend is HCG, keeping the corpus luteums in the ovary, making it unhappy and aggravated. Researchers decided there had to be a better way, and thus the second concoction was born. This one uses gonadotropin-releasing hormone agonist, and then uses HCG again as a trigger. The biological difference is that the body has already been exposed to an abnormal amount of hormones, so if OHSS occurs, it'll usually be less severe and not last as long. In our analogy, it's as if your friend warned you that they were going to have a party and gave you earplugs. There's a chance that you will still get mad, but it's less likely. Then we have the third scenario. This uses gonadotropin-releasing hormone antagonist and then gonadotropin-releasing hormone agonist as the trigger. We can figure this out by breaking down the words. We have an antagonist and an agonist. So one's going to prevent something and one's going to promote something. What they're working on are the receptors on the anterior pituitary gland in your brain. This will either release follicle-stimulating hormone or suppress it. So, we start out with no eggs being influenced at all, and then the trigger is given and a surge of follicle-stimulating hormone promotes lots of eggs to mature at once. We still got our analogy. So, your friend lives down the block, so you can't hear the party. The end. But wait, what about the corpus luteum? I hear some people ask. Well, remember how I said that in a normal person who is not pregnant, the corpus luteum disintegrates? This is because of a hormone known as luteal hormone, which happens to be a gonadotropin, one that is also stimulated by the gonadotropin-releasing hormone that we use as a trigger. So, the corpus luteum disintegrates like it would naturally. So we have a solution. Everybody can go home and have a good day. But we can't, because clinics in America choose not to use this third procedure because they view it as too expensive, even though it's the safest. The icing on the cake is that they don't tell the donors the risks involved when they sign up. Clinics have a responsibility to let donors the risks that they're getting themselves into and to choose the procedure that is the safest for the patient, no matter what the cost. So, by telling you, maybe you'll tell your friend who will tell their friend, and if any of us decide to donate eggs, we'll know what procedure to choose. The safest procedure, without your friend HCG. Thank you.